when you fall on the shoulder like that, the shoulder dislocates posteriorly. In that way, it tears an important structure in the shoulder joint that's called labrum. It's called the posterior labral tear. Now that thing causes pain on the backside of the shoulder joint and can cause multiple dislocations. So when you push on the shoulder, on the arm bone of the patient, it kind of dislocates posteriorly. It's unstable and that needs surgical repair. So when you go with the arthroscope inside the shoulder joint, you see the entire labrum has come off the bone. Now you've got to repair that back to the bone with the help of suture anchor, and you should aim to build a nice bumper across so that the shoulder doesn't dislocate again and the patient will have a happy life, happy shoulder.